I don't know so much that it has to be specific interests and hobbies, but I think one thing that an individual needs to have like as a priority is the way how caring they are, maybe for individuals, for their job, for their dedication. So just interest in caring for people and doing things to make people feel better. I used to be a staff nurse in the OB department, and currently am the nurse manager. And we still, I still have challenges with this. Is having patients come in to deliver a baby that is stillborn, which is no longer living. And so that's very challenging, not only for obviously the mom and the dad or whoever her support person is, but the staff as well, just dealing with that situation. Because a lot of times you hear OB is all about bringing new life into the world, which a majority of the time it is. But then on the downside, which again, it's very rare, we do have those instances where we have to support those families through those difficult times. Being in a delivery with a mom that actually delivered her baby without an epidural, because we see a high use of epidurals for pain relief. But I really liked those patients that came in and they did not want to do any type of medication. Yes, I am. I am very happy with my career choice. At first, when I went into school, I thought I was going to be a teacher, but then I changed into nursing. And I'm glad I did that because I've always been one to have that caring aspect, and wanting to give to those individuals that maybe either are sick, dying, because I did do some med-surg telemetry nursing. Actually, I started here at Mercer Health when I first got out of nursing school, so did that for a while, and then went into OB. But I do really enjoy the aspect of caring for patients, whether they're laboring or whether they're an elderly individual, and then also helping staff learn what they need to learn to provide that quality, safe care. In my position as a nurse manager, I typically arrive usually about 7:30 in the morning. We wear hospital provided scrubs. As a manager, I'm not required to wear the hospital scrubs, but I do because at any given time our census can change. From having maybe a low census and then all of a sudden we get a couple labor patients in. So I always want to be ready to be able to help the staff and be out there helping them with that patient care, as well as being prepared for any type of emergent situations that could arise. Skills for an OB nurse when you're out doing bedside care is a RN degree. You can do an associate's degree or a bachelor's degree. But as far as the skill, I mean, you need interpersonal skills, being able to interact with the mom and the dad and any support that that mom has in the room. You need to be able to teach them skills that they are going to need to utilize to take care of themselves and the baby after discharge. You need to have hands-on skills, for IV placement, as well as, we do a lot of like palpation with when mom's having contractions. So, using your senses for assessment. So just good, thorough assessment skills. We use fetal monitors, but that, relying on a fetal monitor is not always the best thing. So just getting your hands on that mom's belly and making sure that, you're feeling those contractions and how strong they are. And then also making sure, helping her change positions. So just again, being that caring individual and helping support that mom through her labor. To be a staff nurse, I went to school at Bowling Green State University and then graduated with my bachelor's in nursing. And so it was a 4-year degree. And I do recommend anybody that is looking into going into nursing to go ahead and get that bachelor's degree pretty much from the get-go, because the Ohio Board of Nursing is mandating that nurses have their bachelor's degree. So that is a transition that is going on right now. Some of the nurses that have been in nursing for numerous years are going to be grandfathered. If they have an associate's degree, they won't have to go get their bachelor's. But the younger, newer nurses that I've hired, they've been going back to school, doing online training, while they're working, maybe while they have kids or having new babies, to get that bachelor's degree. And then I'm currently enrolled in my master's program for healthcare administration through the Ohio University, and that is a graduate program that will take me approximately 2 years to finish. Yes, there has been. When I first became a nurse, I started here at Mercer Health, worked here for 8 months in med-surg telemetry department, and then we relocated to the Troy area. So up until my return to Coldwater in 2009, I was a staff nurse at 2 different facilities doing maternity work and OB. And then with our return to Mercer County, I was hired back in here at Mercer Health, and I started out as the nursing supervisor for the hospital. So it's kind of house-wide nursing supervisor. And then 3.5 years ago, I was promoted to the manager of the Childbirth Center, so the position that I have now. There is a lot of opportunity right now in nursing, especially here at Mercer Health. We've had some position changes, just some opportunities that have presented themselves for individuals that wanted to either, grow in a different area of nursing, or go on with a promotion. So currently here in the OB department, we do have a position that is open that I am interviewing for right now. And then also on our med-surg telemetry department, which is the inpatient floor, there is openings there as well. So currently we do have openings in the field, and I definitely see that continuing because we do have individuals that are in the nursing field that will be retiring. So as they retire, we will continue to have those openings. Actually, I don't think I would change anything, to be honest with you. I'm really satisfied with where my career has taken me. I don't know what the future holds for me, but I feel like where I am today, I have been successful, and I've taken every opportunity and every experience that I've been given throughout my career as a learning experience, growing, and just strengthening me for the next opportunity. The typical staff nurse starts out around $22, $23 an hour, and they top out about $32, $33 an hour, at least here at Mercer Health. And that's kind of an estimation. I don't know for sure, but those are the ranges of the salaries. Like, you don't have to enroll. It's an open enrollment. So depending on, what your situation is, but medical benefits, dental benefits, vision, prescription drugs. We also have a flexible spending account benefit where you can go ahead and have money deducted from your paycheck and placed into an account that you can use for medical expenses that are not covered by your insurance. Short-term disability, long-term disability are just a majority of the benefits. It does take me away a little bit from my family and from my friends, but I always take time to spend time with them and also spend time for myself. You have to have that balance. My advice would be is to do some job shadowing, and we offer that here at Mercer Health. Is get out there, kind of experience some of what you might be interested in. We do have the nursery here because you mentioned that you were interested in neonatal nursing, and we do have the nursery here, and we have students coming and going pretty frequently within the department and working with the nurses and seeing, those assessments and things that they're doing with the babies and the moms as well. I would say, reaching out to facilities or departments that you're interested in and doing job shadowing. That way, kind of have an idea of what you're going to be getting into. And if that's something that you really want to do. And then with your schooling, I would definitely look into a 4-year degree. If you are going to do nursing, just go ahead and get that bachelor's from the beginning.